Hello and Assalamualaikum. I'm Putri Nur Shahira from BPT 27B. Today I'm going to present about Time Up and Go. Time Up and Go test is a simple test used to assess someone's mobility, lower extremity function, and risk of falling. Numerous clinical illness and geriatric population have been researched with the TUG, including individuals with Parkinson's disease, amyotrophic lateral sclerosis, stroke survivors, and patients with orthopedic abnormalities. Time Up and Go test has no limited time and can be performed at home with healthcare provider or physiotherapist permissions. When patient using assistive device while doing this test, we cannot give them physical assistance. But if patient have poor balance, someone should be by their side to prevent them from falling, but still cannot hold them up. Commonly, healthy older adults can complete the task in less than 10 seconds while more than 2 minutes for very frail older adults. This test requires no special equipment or training. It is very quick and easy to put as routine medical examination. This TUG test requires only a few pieces of equipment, like a chair, standard chair, stopwatch to record the time, measuring tape to measure 3 meters from the edge of the seat, piece of tape or chalk to mark the distance on the floor. Basically, you can just use anything to use as a mark. Regular walking shoes and any assistive devices if needed. It is important that the chair to be stable so it doesn't move or slip away when patient standing up. So it usually can be prevented by setting up the test on the carpeted space. So the procedure is patient need to sit on the standard chair with arm resting comfortably on the lap or at the side. Then stopwatch will start when the physiotherapist said go and the patient is standing up from the chair. So patient need to stand up and walk for 3 meters with usual assistive device if necessary, then turn around, walk back to the chair and sit down. The recorded time is the TUG score. Here is the demonstration video for the TUG test.
Which we want to assess his mobility and lower extremity function and risk of falling. So we will do at the 3 meters distance and then he will go back and sit down. The time that we recorded is the result of the TUG test. Okay, hi sir, Assalamualaikum. I'm Putri Shahira, your physiotherapist for today. What can I call you?
You can call me Hakim.
Mr. Hakimi, today I want to do time up and down test, which I want to test your mobility and lower extremity function, and to assess your balance, which is your core of the spine. So, when I go, you will stand up and walk with this normal speed. Then you go to the brake and pass by the brake, turn back and sit down. Okay? Can we start now? Okay. Start now. 1, 2, go. Alright. Thank you for your cooperation.
We proceed to validity and reliability. What is validity? Validity means a study or analysis that shows the test level of accuracy for a certain parameter. This TUG test showed excellent concurrent validity for patients with spinal cord injury and stroke. Data on predictive validity was limited. The other research showed TUG was predominantly related to Core Outcome Measure Index, COMI. COMI represents the general condition including function, pain, symptoms, and quality of life. It can be argued that TUG gives a full evaluation in cases of lumbar spine surgery. Both short form 12 and Eurocall 5 dimension are questionnaire that measures a person's quality of life and health. So the correlation of TUG with SF12 and EQ5D following surgery and rehabilitation therapies may show higher validation coefficients. Furthermore, because the quality of life is more noticeable in the chronic period after the health service is provided, it will be critical to assess the criteria validity after long term follow up in future studies. Next is reliability. What is reliability? It determines whether the questionnaire can consistently capture the clinical status of the same individual under identical clinical conditions. As I take from one research, interrogator reliability they do by two observers took the test in alternate sequence at various times during the same day, while intra-rater reliability the patients performed the test for a single observer twice in a row, separate by 2 weeks. This test showed great reliability in patients with cerebral palsy, multiple sclerosis, stroke, spinal cord injury, and Huntington disease. It showed excellent reliable results in patients with lumbar spine surgery, LSS, in future research, presenting the reliability with Blunt Altman agreement analysis might reveal a broader overview of TUG's reliability in patients with LSS. Minimal clinically important difference, MCID, showed the smallest clinical significance difference in seconds. It was shown that improvements in smaller units were more therapeutically relevant in older persons. For the outcome classification, this TUG test measures in seconds. Less than 10 seconds indicates normal mobility and no significant fall risk. It reflects good functional mobility and commonly in healthy and active adults. For less than 20 seconds, it suggests good mobility with some functional limitations but still independent in daily activities. For less than 30 seconds, it indicates decreased mobility and possible fall risk. Further evaluation and intervention may be needed, and some people need walking aid or support. But there's another one which is more than 30 seconds. It strongly suggests significant mobility issues and a high risk of falling. It requires immediate attention, including possible assistive device or physical therapy. There's cut-off scores for specific populations such as community dwelling older adults. When more than 13.5 seconds often indicates a fall risk. For post-stroke patients, there's more than 14 seconds and Parkinson disease more than 11.5 seconds. But for frail elderly, more than 20 seconds suggests significant mobility impairment. This TUG test is well-researched outcome measure in geriatric population but lack of data for young and middle-aged adults. TUG performance generally slows with age and individuals with neurological conditions, even if functional condition is maintained. That's all from me. Thank you for your attention. That's all from me. Thank you for your attention.